Welcome to the Dietitian Side Hustle podcast. My name is Katie Dodd and I am a nutrition entrepreneur. But here's the catch. I have a full-time traditional dietitian job. My entrepreneurial endeavors are my side hustle. I've been making six figures through my job and side hustle doing things that I love. If I can do it, you can too. This podcast is for dietitians, interns, and students who want to be inspired to start or perfect the side hustle of their dreams. Let's do this. Hello and welcome to the 69th episode of the Dietitian Side Hustle podcast, my last day at the VA. Today is December 29th, 2021, and this is the last day that I will ever be working for the Department of Veteran Affairs. And I will tell you that it is so bittersweet. I shared in the last episode of the podcast that I quit my job. I turned in a 1-month letter of resignation, and today is my last day. And it's bittersweet because I love working for the VA. It is a lovely place to work, as you will hear through today's episode. But I know that God has bigger and better things planned for me. So it's bittersweet to leave. I'm excited to leave, but I'm also a little sad. So I wanted to take today's episode to just get a little nostalgic with you guys, talk to you about my journey through VA, share some of the cool experiences I've been able to do in VA. I also want to talk to you guys about benefits of working for the Department of Veteran Affairs. You know, this is Dietitian Side Hustle, so a lot of you have traditional jobs. And if you are thinking about, oh gosh, where should I go for my next step in my career? I can't rave enough about VA. Had I decided to stay in traditional employment, 100% I would have stayed at the VA. I also want to talk to you guys about money. You guys know I like talking about money. And then just some last reflections with my last day working for VA. So I have been at the VA since 2008. It was my first job out of school, and it has been such an amazing journey. I've been there for over 13 years. So what led me to the VA? I'll tell you. It was money. When I was an undergrad at California State University, Chico, we had a dietitian come talk to us about dietetic internships. And she was talking about paid internships. We know this is like a unicorn, right? There aren't a lot of paid internships for dietitians. And she said that two good places for paid internships are the VA and WIC. So I took a mental note, and she also talked about the benefit of federal employment. And I was like, okay, VA, this sounds good. Fast forward a couple years when I was doing my combined master's and dietetic internship program at Southern Illinois University, Carbondale. We had the opportunity, so pretty much at that place, I got my master's degree first, and then we would go complete our rotations. There were lots of different places you can be placed at, and it was kind of a little bit competitive because VA was the only one that actually paid for rotations. It wasn't a full VA internship, but 2/3 of my internship was at the VA, and they paid a stipend, which, when you're a student, like a stipend is a big deal. So when I first got to Carbondale, because I knew it could be competitive to get into the VA slot for the internship, I actually started volunteering at the VA. Number one, I wanted to kind of experience, is this really what I want to do? And then also I wanted to increase the likelihood of me getting a chance of interning there. And I figured, gosh, if I volunteer and I get my feet wet, it increases my odds of getting placed there. So I remember I had contacted my DI director. She contacted a dietitian at the VA and asked if I can volunteer. And they told me no. So a very early lesson in my career. So they told me no, but it wasn't a solid no. It was more of a not yet. It was more of a, we're kind of busy right now. We're short-staffed. It's not a good time. Get back to us later. So I wrote down in my calendar, and you better believe I followed up with them. And then they said, okay, let's do this. And I started volunteering at the VA. Now, I went to the VA for the money, but it did not take me long to completely fall in love with the mission of the VA. I volunteered there. I ended up getting placed for my internship. 2/3 of my internship was completed at the Marion, Illinois VA hospital, which was amazing. I loved the VA so much. When it came time to apply for jobs, I applied for quite a few jobs, one being the VA I am currently employed at as of today. And I work at the VA Southern Oregon Rehabilitation Center and Clinics in White City, Oregon. And I chose this facility because my brother was living in White City. I only have one brother, and I wanted to be close to him. So I'd never even heard of this VA facility before. But when I was, completing my internship, I'm like, oh my gosh, I love the VA. I must work here. I ended up applying for lots of jobs, was so fortunate to get placed at VA Source. We call it Source for short. So, gosh, I can't tell you guys how amazing working at the VA is. There are lots of VA facilities across the country, and like any big organization, there can be politics, at every single level, and every VA can be a little different. But my experience at the 2 VAs I've been at has been absolutely amazing. I remember when I got my first job out of school, I got the phone call. I was at Dairy Queen across the street from the Marion, Illinois VA. I was with my fiance at the time, and we were getting lunch, and I got a phone call from VA Source, where I am currently employed, and they let me know that I got the job, and I was just so excited, so ecstatic. I was still actually an intern. I hadn't even graduated at the time. I wasn't a dietitian. It was still a few weeks out till graduation. I was like, oh my gosh, I got my first job. So I ended up accepting, and, I graduated in August. I actually got married and graduated the same day. I walked down the aisle to graduate in the morning, kind of like afternoon, and then in the evening, I walked down the aisle at my church and got married. From there, my husband and I flew out to Hawaii for a really wonderful honeymoon, flew back to Illinois, loaded up a U-Haul, drove to Oregon. I think we got to Oregon, then like 1 or 2 days later, I was at work working my first job. So my job at VA Source is a home-based primary care dietitian. So when I applied for the job, I had no idea what home-based primary care was, like no idea at all. I'm like, okay, well, whatever, it's the VA. I want to work there. So, home-based primary care is working with an interdisciplinary team of professionals. So nurses, social workers, psychologists, pharmacists, physical therapists, the dietitian, like the whole interdisciplinary team. And really it's more of a case management model. So we are working with a small group of veterans. We do go into their home, but it's that interdisciplinary care. We discuss our patients every week, and it's almost like textbook healthcare because you have like access to all these interdisciplinary team members at your fingertips, and you get to see all of the veterans in the program. You don't have to wait till they screen positive for being malnourished to finally see them. You get to see everyone, and then you get to choose your schedule for how much you follow up with them based on what you feel is clinically indicated. And it's just so cool to be able to follow them over time and to see their lives improve and change because they have an amazing healthcare team helping support them in their homes. So I had no idea what HBPC was, but I will tell you, once I got in it, I was like, whoa, dream job. This is textbook healthcare, what it should look like, what it doesn't always look like. But, I got to tell you, I was very, very lucky. When I started at VA, I was 25 years old. A lot of people spend a lot of time trying to get into the federal government, so I was quite fortunate. So I guess I want to tell you guys a little bit more about why I love the VA. And I think I'll tell you more about the benefits. That's one thing. But anyone who works at the VA, they are there because it is mission focused. We are there to serve our nation's veterans. President, Abraham Lincoln, from way back when, there's a quote that is the mission for VA. And Lincoln said that the mission of VA, well, I guess VA wasn't around when Lincoln was around, but our mission is to care for him who shall have borne the battle and for his widow and his orphan. And pretty much what that means is we take care of veterans. They serve our country. We're going to make sure we take care of them in any way possible. And the VA does that in multiple ways. There are benefits through the Veterans Benefit Association. So if you ever hear of home loans for veterans, school, help with going back to school. We've got healthcare benefits through the Veterans Health Administration, and then even all the way to the end of life through the Veterans Cemetery. So VA is a huge organization, and I can't tell you what a privilege it is to wake up and go to work every day and serve our nation's heroes. People who are in VA, they stay for the mission, and it is, it's not about making a buck. It's not about making money. It's about taking care of our nation's heroes. And that's what's kept me at VA all of these years, is just having that, privilege of serving veterans. So love the VA. When I first started in August of 2008 for my first official job, I was a home-based primary care dietitian. I've remained one throughout my entire career, but it's kind of changed a little bit. For a while, I was our Move weight management coordinator. And so that just meant that like half my time I was seeing veterans in the home, the other half I was coordinating a weight management program. I really did more like employee wellness through that. But then over time, I ended up shifting back to being full-time home-based primary care. So the cool thing about my journey at VA is the VA Source has enabled me to do all kinds of cool things outside of my traditional job. So I've got my job on paper and, I got seeing patients, but I guess one thing about me is I'm kind of an overachiever. I kind of go above and beyond. And so I always like doing extra things to give back, to serve, to help, to use my different skills, talents, gifts to help people. And so some of the random things that I've been able to do at VA Source, I remember when I created a facility map. So our map at the VA was horrible when I got there. It was like a photocopied, like engineer's map that, has all the wiring and details. It's just like hard to read. So I ended up creating a map. Initially, it was a walking map through the Move Weight Management program. And then it ended up becoming the facility map. And it was so cool to like map out the whole facility and design the map for VA. And who am I? I'm just a dietitian, but they let me do that fun project. I was able to get grants early on when I was doing a lot of work with employee wellness. We ended up painting lots of murals throughout the VA in the stairwells, encouraging people to be active, to walk more, to take the stairs. I organized softball teams for employees, so employee softball teams, kickball teams. We had a running group. We would do amazing health fairs. I remember one was actually called Day at the Beach, and we actually brought in a bunch of sand and had a little like pool full of water. Our grounds people cut a bunch of bamboo that kind of grew crazy in our facility, and they brought it indoors. We had this big building, it's like a big room called the theater. And so we actually brought the beach inside, and we had we made little healthy smoothies with little like umbrella drinks, the umbrellas that go in the drinks. So anyways, I'm babbling, but it was a really fun event. It was called Day at the Beach. I also used grant money at one time and got 5 really cool cruiser bikes for employees to check out and ride during, lunch break, before work, after work. We had some grant money. I got yoga kits for staff. We hired someone to come in and teach yoga. We got some money to get little exercise balls for employees to sit on, to have that active sitting when they're at work. We organized groups of employees doing mud runs, color runs, different fun runs. I actually, I'm a blogger, but a lot of my website work started when I was in the VA. We use a program called SharePoint. It's like an internal website to VA, and I learned how to manage SharePoint. It was so much fun making these pretty user-friendly websites. I not only made one for my department, but I started making them for other committees, for other departments. I even started helping National VA with designing websites in VA on SharePoint. I love leadership, so I have the privilege of serving as acting chief of home-based primary care. And in the VA system, a chief just means like the department head, right? So they're the boss. So whenever my boss would go out of town, I would cover in place of them and would, serve as acting chief, which was always so much fun for me because I love leadership. I got to help with the Joint Commission inspections. And I know to a lot of people when Joint Commission comes, they're like, oh my gosh, the inspectors are here and they're terrified. But for me, when Joint Commission would come, I would be excited. I'd be like, yes, let's show off how awesome our team is because we have an amazing team. We're always Joint Commission ready. So this is an opportunity to let our team shine. And so I always would help with our Joint Commission visits and I honestly enjoyed it. I helped with our PI projects, performance improvement, our all employee survey. I would help different people throughout the years with their maternity leave, trying to navigate the mystery of maternity leave. So I would help them figure that out. This one's fun. For 10 years, we did this fun bike ride called Cycle Source Cruise. And it was a bike ride for veterans, employees, and volunteers that we would do every year. We got lots of wonderful sponsors through the VA Veteran Volunteer Services. And so that was a really fun activity for veterans and employees. I helped with our facility newsletter. I had the opportunity to mentor many dietitians at my local facility, but also nationally, and then other people outside of just being dietitians. I got lots of fun awards in VA. Towards the end of my career, I was leading our ethics committee, which I love ethics. I feel like there's a lot of things I love that some people don't love, but I love ethics. So I got to help to lead our ethics committee. And then over the last year, I've actually been doing a detail helping with the implementation of the new electronic health record for VA. So, that's a lot of me babbling, but I was just reflecting back on VA and I'm like, oh my gosh, I've done so many cool things here, like completely outside of just the traditional scope of being a dietitian. And I'm just so grateful that I work somewhere that enables me to do things that I'm passionate about and help and serve people in so many different ways. So those are some of my highlights at VA, but I would say even beyond all the fun stuff I've done, my favorite thing has been the people. I have to tell you, VA Source itself is a special, special place. The employees there are so amazing, and I am blessed to be able to work with them. I have the best boss on the face of the planet. His name is Steve. He is a pharmacist, and he has just been such an amazing, supportive boss. I'm really going to miss working with him. Amazing coworkers in home-based primary care and the ethics committee, the electronic health record as of this last year. I mean, just all throughout VA, local and national, I just work with the best people. And the veterans. Oh my gosh, the veterans, you guys. When I would describe to kids, what do I do for my job? I would tell them I get to go hang out with really cool grandmas and grandpas and talk to them about food. And they're like, oh, that's cool. I'm like, yeah, it is. I think some people, they think, oh, you go into people's homes? That's so weird. And it's not weird. I think some people get concerned about safety, and we obviously vet people before we go in. We are trained in safety, and if something isn't safe, we get out. There's lots of things we do to ensure safety for our staff. Of course, that is number one in home care. But it's so cool to be able to go to people's homes and see how they live. And it's not like a sterile clinic with white walls and people feel uncomfortable. You are in their home. You get to see how they live. You get to see their family, their pictures. You get to see how they eat. You can go in their kitchen and show them how to read labels with the foods in their cupboards, how to cook the foods in their kitchen. There's just so much that you see in the home that you might not know if you're in a clinic. I've seen veterans all over the place. I remember one, he was in a yurt. You had to turn left at the broken down car on the road, walk up the hill, and he was in a yurt. He had no running water. He did have electricity, big old flat screen TV and satellite, but no running water. He had to walk up the hill. He had a spigot up there. But different people live in different ways. And it's always fascinating to see that and to just be a part of their lives and their home, because it's totally different. And even the stories that I would get from these veterans, because a lot of them were, more socially isolated. So when someone came in the home, they're just like, oh my gosh, so excited, let's talk. So even though, I'm the dietitian and I'm providing, nutrition care, I feel like some of it was almost social work. You're just sitting there talking to them and just, supporting as you have time. But you know what? When a veteran's telling you a story, you take time to listen if you have it. So I've heard some amazing stories over the years. I remember one veteran, he shared the coolest stories. I remember he told me about his wife. He said that he and his buddy, they were still in the service. They went, I think it might have been church, and there was a girl on the piano. And he leaned over to his buddy and said, I'm going to marry that girl. And sure enough, he did. And they were married for they were married for 75 years or something. And I just think man, that's from the movies. You don't see that stuff anymore. Another veteran, he had shared the story about how he was in the nation's largest friendly fire incident. He was on a ship, and unfortunately, our people started shooting that ship because they thought it was the bad guy. And he had shared how he had jumped off the boat. He's in the water. There's these ships coming over, they're shooting, and he would dive down in the water every time they would come across and start shooting. And he shared that at the time he was an atheist. He didn't believe in God, but in that moment he started praying, and he said, God, if you save me, then I will become a believer. I will spend my life following you. And sure enough, he lived, and sure enough, he kept that, and he ended up becoming a believer, a Christian. And even up into his late 80s, early 90s, he was still reading his Bible every day. And I just thought, what a cool story. Later on, the newspaper featured him, and they had on the headline, they called it Baptism by Bullets. And I'm like, oh my gosh, that is so cool. And it's like, I got to hear it first. So, working at the VA, I've been able to hear so many cool stories from so many veterans. And again, I can't tell you what a privilege it's been. So I love VA. I just want to make that super clear. And I want to talk to you guys a little bit about the benefits of VA, because I do think that the VA is a wonderful place to work for dietitians. First off, there are so many job opportunities for dietitians within VA. Most VAs are hospitals, but there's a lot of outpatient clinics. So you can work as a clinical dietitian, an outpatient dietitian, a home care dietitian like me. You can work in food service. You can work in informatics, health promotion, weight management, renal, diabetes, enteral oncology. A lot of it depends on the facility, because sometimes you have big facilities that have a renal unit or, a big diabetes program. There's also what's called community living centers. These are like nursing homes. So if you want to work in more of a long-term care facility, but within VA, that's an opportunity. And one thing I will say is I've seen lots of dietitians in VA rise up in leadership to become the associate director of a VA facility, the director of a VA hospital, running other departments outside of VA. So it's such a wonderful career to have because once you're in the VA system, it's relatively easy if there's job opportunities to switch from one VA to another. They're all over the country, and the ability to switch jobs. So if you're someone who gets bored easily, you can switch jobs and do lots of different types of, roles as a dietitian within one healthcare system. VA also has amazing health insurance. There's dental, there's vision, there's life insurance. There's a 401k, they call it the Thrifty Savings Plan, and a pension. So who has pensions anymore? No one. So VA is a place where you could actually have a pension. So when you retire, you've got, you'll have your Social Security, your 401k, and a pension. It's pretty sweet. So VA also has very generous leave. How leave works in the VA is you get paid every 2 weeks. So they call that a pay period. Every pay period, you get 4 hours of sick leave, which is cool. A lot of places you get leave. If you're sick, you take it out of your leave. But VA gives you 4 hours every pay period. That's 8 hours per month, forever, as long as you're working at the VA, of sick leave. They also give you annual leave. So every pay period when you start, you get 4 hours of annual leave. After you've been at the VA for 3 years, you get 6 hours of annual leave per pay period. And after you've been at the VA for 15 years, you get 8 hours of annual leave per pay period. So that's pretty sweet. When you first start, you work for 2 weeks and you get 8 hours off, 4 for sick, 4 for annual. And over time, the longer you've been there, the more you're able to accumulate annual leave for, higher amounts. And it's, I've been looking forward to hitting 15 years at the VA because then I would finally get 8 hours of annual leave per pay period. So pretty much I would work 10 days and get 1 day off. I'm like, that's so cool. But here I am leaving at 13 years before I'll hit that, but that's okay. So VA has very generous leave. They also have pretty awesome pay. I'm going to explain the pay in VA really quickly. This might be confusing, but I hope it's helpful to you guys, especially if you're thinking about a VA job. So the VA job is a federal job. They use something called the GS pay scale. You can Google GS pay tables, and it's a table of, there's different GS levels. There's numbers 1 through 15. Within each level, there are steps 1 through 10. So when you look at it, it's this super confusing table. How it works for dietitians. Most dietitian positions, a new dietitian out of school, 0 experience with a bachelor's level at this point, would come into VA as a GS7. After 1 year, they would advance to a GS9. After 1 year, they would advance to a GS11. So that sounds confusing because you're hopping years. But if you were going to start brand new out of school, you would come in at a 7, then advance to a 9 after 1 year, 1 year later, an 11. So even though you'll come in at a lower pay scale in the beginning, you will jump in pay pretty darn fast. If you were coming into the VA with a master's degree or at least 1 year of experience, you will come in as a GS9. In 1 year, you'll become an 11. If you are a dietitian who's, been a dietitian for a long time, you'll probably come in at a GS11. And then once you're in a different grade, example, the 11, you will go up the pay steps from 1 to 10. And I feel like that's super confusing. And maybe I'm in the weeds and this doesn't even matter to you. But if you ever have questions about VA pay, you can always reach out to me because I love talking VA. So most dietitian positions are what's called a GS11 position. That's kind of the top tier. It's confusing because some people think if I'm a 7, I have to go a 7, go through all steps 1 through 10 before I go to a 9, go through all steps 1 through 10, then become an 11. And that's not true. You go 7, 9, 11. Then from 11, you go up the 10 steps. If you are supervising people at a lower level facility, if you are coordinating a program or what's called an advanced level practice dietitian in VA, then you could be a GS12. If you are a service chief, so you're running a department, you could be a GS13. And if you're a service chief at a really big VA, you could be a GS14. And then if you want to get all crazy and become the director of a VA, then you can become a GS15. So there's lots of different levels. And again, you can Google GS pay tables and see what these numbers look like. But that's kind of where dietitians fall. There is locality pay. So depending on where you live, you may be making more or less money. Obviously, if you're in California, you're going to be making way more money than maybe if you're in the Midwest, just because of cost of living. And I guess the last thing I will say, if this isn't too far in the weeds, once you are in a let's say the GS11 for a dietitian, and I mentioned there's 10 steps that you have to go through, it'll take you 18 years to increase through all of those steps. Except the VA has something really cool called special advancements for achievement. What that means is you can actually advance faster in the pay scale by doing things above and beyond outside of the VA. So, I'm just going to tell you guys really quickly about my money journey through VA, about how much money I made and how I was able to advance pretty quickly to make good money as a dietitian in VA. When I first started in 2008, I was making $45,000. Well, it's $45,040. And I'll tell you, being right out of school, all those years of not making money, I was like, woohoo, I'm a baller making $45,000. And I was a GS9. I was a GS9 because I had my master's degree. I was able to go in right at the 9. 1 year later, I advanced to an 11 and my pay increased from $45,000 to $56,000. Pretty sweet. The next year, I actually ended up making a position. I mentioned I was the Move Weight Management Program Coordinator. By adding that role to my job, it enabled me to be what's called a GS12, so that's a higher paid position. So in 2010, I ended up getting another pay raise to become a 12, and I was making $68,000. So not bad in just a couple years to go from 45 to 68. Now, from there, I ended up getting a raise the next couple of years until 2013. 2013 is when I learned about the special advancements for achievement. I was doing mentoring with our associate director at the time, who was a dietitian. And I like to volunteer. I'm a mover and a shaker. I had just gotten a specialty credential. I was on the Oregon Academy Board and the Healthy Aging Dietetic Practice Group. And special advancements for achievement, different qualifications for those, obviously, if you are in VA or considering VA, you have to talk to your human resource department to figure out what your individual facility does. But National has a rule for special advancements for achievement where you can get an advancement if you end up getting maybe your master's or your PhD while working in VA. If you end up getting a specialty credential, that has changed a little bit over the years. There's rules on what that credential can look like. If you get elected to a national leadership position, for example, within the academy or even locally at the state. If you are on a credentialing board, if you get a national award in the field, if you publish research. So there's lots of cool things that the VA recognizes as, oh my gosh, you are out there going above and beyond. This looks good for VA. You're bringing back different skills to VA. We're going to recognize you by giving you a special advancement for achievement. So you are going to, increase in pay faster. So when I was working with the dietitian who was mentoring me in 2013, 5 years into my career, she's like, hey, Katie, you should apply for a special advancement for achievement. There's different criteria, and I qualified for 3 of them. So I ended up getting what's called a 3-step raise. For reference, it would have taken me 6 years of time to get this raise. So in 2013, I got a 3-step raise and my pay went up to $80,000. So in 5 years, I went from making $45,000 to $80,000. That felt pretty good. Now I ended up setting this goal. Once I learned about the SAAs, I was like, I want to double my pay in 10 years. So if I'm at $45,000 now, I want to hit 90 within 10 years. And I'll tell you, I did it in 9. I'm a hustler. I ended up getting special advancements for achievement because I just continue to volunteer and do a lot of stuff in the field. And I maxed out in pay at a GS 1210. And just for reference, right now in 2012, my pay rate at VA is $100,000. Or it's $100,739. So that's pretty darn good for just a dietitian who is not currently running a program, who is not managing people. That is pretty darn amazing pay for being a dietitian for 13 years. So I want to give a shout out to VA because I think that they compensate dietitians really well and they give you opportunities to advance, which is so cool because you don't typically see that outside of VA. So, kind of reflecting back on my journey within VA, I think I was an entrepreneur within the VA. I just didn't even know I was an entrepreneur. A lot of the business skills that I now have, I'm like, oh my gosh, I was using these in VA to do all these fun, innovative things, to advance and pay, to serve, to help, to do all of these things. So I hope that was helpful for you guys. I know I was getting in the weeds a little bit about the pay and the benefits, but I hope that's helpful for some of you listening as you're considering VA for employment. Because again, I can't tell you how much I love the VA. If I were staying in traditional employment, I would 100% be in VA. And if you ever want to chat VA, reach out to me, email, Facebook, Instagram. I am happy to tell you all about how awesome VA is and give you some tips if you end up having an interview with them. So today is my last day at VA. And it is so bittersweet. It has been an amazing journey. It has been the biggest privilege of my career to serve our nation's veterans and to work with so many amazing people within VA, Southern Oregon Rehabilitation Center and clinics, and nationally. And I am always going to love the VA. It's got a piece of my heart and always will, even though, starting in 2022, I am going to be a full-time entrepreneur. I'm always going to love the VA. So thank you guys so much for listening to me be nostalgic and talk about my career and my journey at VA. It's been such a fun one. And I am just so excited for what's ahead because I know that God has even bigger and better things planned for my career. So thank you guys so much for listening today and can't wait to chat on the next episode. Bye, guys. Thanks so much for listening to the podcast, guys. Be sure to head on over to the Dietitian Side Hustle website at dietitiansidehustle.com and check out our coaching page to learn about all the ways that we can work together. Have an amazing day, and I'm so proud of you for taking the initiative to listen to this podcast. Now go out there and get it done. Bye, guys.